I want to give you the clinical pearls regarding longevity practice, longevity medicine protocols that I learned at the 13th Annual PhleboEgypt conference. So this conference is for vascular surgeons and anyone who's an expert in the field of phlebo-lymphology. So as a lymphedema therapist, I gave a presentation on infection in lymphedema, and I also got to stay for the entire session and picked up some great tips, clinical pearls that I want to share with other medical experts who are helping people on longevity medicine protocols. So I have a few pages of notes and I'll just go over them with you. So the first really fascinating thing that I really wrap my mind around is the concept that the vessel wall is an endocrine organ. So we need to focus on vessel health in the blood vessels, in the lymphatic vessels, in the veins and arteries, because the vessel wall itself has a role in healing and definitely a role in improving our patients' clients' health span. The second big concept was that GLPs, we already know that these GLP receptor agonists are good for more than just weight loss. And the researchers, the clinicians that gave a presentation on this shared that they also have an effect on the vessels of the body. They have an effect on the endothelial nitrous oxide. GLP-1 receptor agonists have an effect on plaque formation. They have an anti-inflammatory effect, and they have the effect of lowering of MACE, which is that major adverse cardiovascular events. So this is a different way of looking at the even increased benefits of GLP-1 receptor agonists. And then we also saw a presentation on peptides, and the concept was that peptides may have an effect on vascular repair. So more research obviously is going to happen on this in the future, but just understand that the peptides, including the GLP-1 receptor agonists, also have effects and potentially positive effects on vascular health. We had some really great medical students come and give presentations on the future of medicine, of vascular medicine, and the two big topics they talked about were AI and robotics. So as far as AI, artificial intelligence in disease prevention, they talked about the concept of having smartwatches, having wearable ECG technology, having smart rings, having continuous glucose monitors, and that be the real concept of medicine in the future, of medicine in the living room as the diagnostic suite for a lot of the initial health data points that we're going to see our clients and our patients come in with the future. They're getting these data points from their smartwatch. They're getting data points from the wearable ECG. They're getting data points from the smart ring, particularly in recovery, in stress, in sleep. They're getting data points in their glucose monitor. It's enabling them to do their conservative care of their diabetes, to understand what spikes their glucose, to keep more of a constant flow of information on what their current glucose levels are, and potentially reducing the effect of complications of diabetes if these disease prevention tools, these wearable tools, are used correctly, and if the patient wants to use them to help reduce potential complications from diseases. And we also talked about the concept of the human role and the AI role. I really love one of the statements that was made is that doctors are not going to be replaced by AI, but a doctor that knows how to use AI is going to replace the doctor that doesn't. So this is a role that we're going to be able to use as a tool. So the human role in the patient-doctor relationship, in the therapist and client relationship, is empathy, is compassion. That's what we can deliver that even the best AI will never be able to deliver, that human touch, that compassion, that ability to deliver upsetting news with compassion and empathy, and then just have compassion and empathy for our clients' journey, and understanding their health journey and really giving their care a human touch. And the role of AI is going to be to spot patterns as the data points exponentially increase. Potentially, hopefully, we will get artificial intelligence to help spot things that maybe a human, especially an overwhelmed human, especially a human that's going through burnout, would not be able to catch. So the AI is going to help anyone who is in the medical field to catch these issues faster and give the patient the chance to get into treatment to make changes to improve their health faster. So that's the benefit of AI. Interestingly, there is a performance hierarchy in medical AI. So we know there's several different companies that are working on medical AI. And it was, if you're a patient, if the client is using AI to, the advanced version of Google their symptoms, ask questions about their treatment, that is going to differ based on the AI program that they use. And this is in flux even today, because that was the first question to the presenter, was these studies that you have that shows that, like Grok versus ChatGPT versus other AIs, there is a hierarchy of some are better with their answers than others. But as soon as the research is published, it's the next iteration of all the AIs have already advanced. So we can't really pin down and say this AI is better than that AI and expect that same answer to be the same in 18 months or even in 6 months. But it's good to help understand that as these programs advance, that even a couple of years ago, they are not all generics for one another. Some programs will be better at giving answers than others, and to pass that information on to clients so they understand that as well. We also talked a lot about general vascular tips to help keep the clients healthy, improve their health span, help to reduce their disease. So some of these general tips: delayed wound healing and infection risk. So if you are seeing delayed wound healing, you're seeing increase in infections in a patient, in a client, look to, is their diabetes under control? Do they have excess cortisol? Do they have malnutrition? And this doesn't mean are they skinny, because people of any weight can have malnutrition. It's based on what they're eating and how their body is digesting and accepting those nutrients. So malnutrition doesn't just matter of the BMI or what it says on the scale. And then also look at endocrine dysfunction. So those are the 4 things that you really need to pay attention to if the client seems to have delayed wound healing, higher risk of infection: diabetes, cortisol, malnutrition, endocrine dysfunction. And then we had really great presentations on how to lower the risk of venous thromboembolism. And it seems like a lot of the good health advice that we're already seeing given. There's no real surprises here, except maybe one, and I'll share the one little surprise that kind of all had us laughing and talking throughout the rest of the conference. So it's eating over 5 servings of fruits and vegetables can help lower the risk of venous thromboembolism. Eating 1 serving of fish weekly, at least. Having less than 1 serving daily of red meat or processed meats can change your risk for venous thromboembolism. And this has to do with antioxidants, omega-3 fatty acids, and then ask the nutrition expert about folate in the diet, B6 in the diet, again, omega-3 fatty acids in the diet, and vitamin K in the diet, especially if someone is really wanting to do everything they can to lower their risk of venous thromboembolism. The big one that's no surprise: stop smoking nicotine. Smoking nicotine is associated with increased risk of venous thromboembolism, and also the low fat, high fiber diet combined with exercise. This is really good. The vegetarian diet, the Mediterranean diet, the DASH diet, these are 3 things that potentially clients can look into as an eating pattern that can be used consistently. And I really like that we heard about the Mediterranean diet here in the area of the world in Egypt, where it's a native diet to we're within the area of the Mediterranean, and just seeing in the conference that idea being shared, and then at the table you can see options that people can use to have that eating pattern in their life. And the one thing that we were talking about specifically in the research, consumption of French fries. Consumption of French fries is a problem if someone wants to reduce their risk of venous thromboembolism. So these are my takeaways that I got specifically for people who are on a longevity medicine protocol. And if you're an expert in longevity medicine, I would encourage you to get more information on venous and lymphatic health, and how that positive information can help your clients to live longer and have a longer health span. Thanks, and have a great day.